injections, give Brad Weight Loss a call. The program's all natural. I lost 35 pounds in 40 days. Call Brad Weight Loss today.
I am so excited to be sitting here talking with Dr. Matt Bernard at Parkridge Bone and Joint. And if you are going through any type of pain dealing with your peripheral nerve, you're going to be happy to hear from him too. So good to see you.
Good to see you as well.
I did not go to medical school. That's going to be your territory for us to discuss. But I think what I've heard you say that has you so excited is that, first of all, Parkridge Bone and Joint, the only ones in town utilizing this, but it's a way to kind of freeze a nerve.
Yeah, the fancy medical term is cryoneurolysis. But basically, we identify the nerves heading to your knee, either for chronic OA knee pain or for preoperative for post-op pain control. And we'll find the nerves and then we freeze them. The myelin sheath that your nerve stays in stays intact. The nerve cell body is actually in your back. This is just the nerve's arm. And so when we damage the nerve's arm, it very reliably grows back at 1 millimeter a day. So if we come up about 9 centimeters from the target, we get a 90 to 100-day block. That's really helpful for post-op pain control.
So, I want to see if I can understand this a little bit. So this is not meant to be a preventive, hey, do this, then you don't have to go through surgery. This is a way to make the surgery less problematic.
Yes, but it also has worked both ways. So I've had some patients that thought they needed surgery. They had this cryoablation, and then they said, hey, doc, I don't need surgery right now. And they waited a year or two. I've had other folks that are in their 90s that know they're never going to get surgery, and they'll come and get it every 6 months or so.
Because I know that's got to be so heartbreaking for you as an orthopedic surgeon to see people come your way and they're in pain.
Absolutely.
I mean, like life debilitating, I can't walk up my steps pain.
Yes.
And sometimes they don't have time to just wait for the insurance companies to come through.
Absolutely. And the other best benefit of this is decreased opioid use. And so opioids work, but the side effects are terrible. We know addiction is a real thing. And so if we can do anything that's non-opioid to help with pain control, it's really a big bonus for the patients.
You and I were chatting a little bit off camera, and I asked you when something like this comes to the market. You said it's been around for 8 years or so.
Yeah.
But do you as the doctor have a chance to kind of vet it, if you will, yourself? And you quickly said, oh yeah, you wouldn't have brought this on if you didn't believe in it.
That's always a touchy thing, because you don't want to be the last guy using something that's out of date, but you don't want to be the first guy using something that may not work.
Right.
And so about 8 years ago, an anesthesiologist that needed a knee replacement saw this at one of his conventions. I saw it at one of my conventions. We got together, we discussed, hey, what are the risks and benefits of this? Yeah. Let's try this. And he was the first one we used it on, and it was successful, and we've been using it ever since.
So within your role at Parkridge Bone and Joint, do you focus on any one area of the body? Are you more the knee guy, the shoulder guy?
Hips and knees.
Okay.
Yep, we've got a shoulder guy, we've got other hip and knee guys, we've got a generalist, but I'm just hip and knee replacement.
Okay, so if you are watching today, and maybe you've been going through, a lot of us have back pain, right?
Yes.
But we don't identify it coming from the right source.
Yes.
Could it often be that there's an issue with your hip and knee alignment?
We share
and
a lot
that's causing
we
it?
share a lot of extremity patients with our back doctors, and we have a good relationship with the doctors at Parkridge as well.
Yeah.
Both neurosurgery and orthopedic surgery, where we'll share patients back and forth who we may thought it was a back, but it's actually a hip, or they thought it was a hip, but we send it to the back.
I know enough to be dangerous, Matt. I think I've heard that hip replacement surgery has come such a long way that it's almost just a easy peasy in and out.
About 80% of our patients are outpatient surgery, but they'll come in the morning and go home that afternoon.
Okay. Knee surgery, not quite so much?
Knee surgery just as much, but knees tend to hurt a little bit more, which is why I'm really excited about this device, because this is bringing knees up to the level where the hips are.
I mean, we've all heard these stories of people, and you could have 5 people in a room who've gotten a knee replacement surgery, and they may have 5 different outcomes.
Absolutely.
Right?
It's a lot about what you bring to the table, both from a health standpoint, but also an approach and an attitude standpoint.
Right.
And so if we can sort of get over that, what are each person's challenges to the joint replacement, that's huge in helping the whole person.
I'm really glad you made the comment about the 92-year-olds who aren't going to go through surgery, but they shouldn't have to live in pain.
No.
Does this, when you do this freezing, is it almost instant relief? Does it take a while for it to kick in?
It takes about 2 weeks for the nerves to fully degenerate. It's called Wallerian degeneration, but it takes about 2 weeks for them to fully degenerate, and then they start growing back after that.
So that myelin sheath, you're taking me back in time. Once upon a time, I knew some of this stuff.
Think about the conduit that the electricity travels in.
Right.
So it's a waxy sheath that the nerve travels in.
So that can be damaged?
It is not damaged with this device.
With this, but in life, that myelin sheath can experience some damage to it?
That's what we see when people have peripheral neuropathy.
Okay, and so that can regrow, and this freezing helps that to happen?
No. This is just the nerve's arm.
Don't take my notes.
That's okay.
Okay.
Yeah, no, this is just the nerve's arm. The myelin sheath, the waxy layer stays intact throughout the whole thing.
Okay. If somebody makes an appointment with you, do you just first assess them and then listen to everything they're experiencing, and then you'll say, yes, this could be good for you, or no, you don't want it, and here's
Absolutely.
why?
Your doctor visit should be a partnership. It should be a relationship. You
Yeah.
should be able to ask your doctor questions and sort of figure out what is the best treatment option for you. And to have just one more tool in the toolbox other than cortisone, other than the viscosupplementation, other than surgery, it's just been an added tool.
Which is part of what has you so excited to be part of
Absolutely.
Parkridge Bone and Joint, because that's what you're called to.
Yes.
You want to be the surgeon helping people.
Absolutely.
All right, doctor's orders. Here's where you'll find him, Dr. Matt Bernard at Parkridge Bone and Joint. The number and the information there on your screen for you to make your appointment. I'm not going to try to tell you what this is called, but if you've got peripheral nerve issues and pain, this freezing technology perhaps could be the answer you've been looking for. Great to see you.
Thanks.
Your mornings are busy at Local 3 News Today. We know that.
Some breaking news just
traffic, and the big news of the